Hi, my name is Helen Howard. I'm the acute falls nurse for the Trust. We've been working on a falls collaborative across ELHT to reduce patient falls and falls with harm. We've used a number of tests changes to reduce these falls, which have worked significantly, and we've managed to reduce falls by 36% and falls with harm by 100% on those 5 wards. With the tested change that we've used, we now want to roll this out across Trust to hopefully significantly reduce falls as a whole for ELHT. The purpose of this film is to talk about the tested changes that are going to be coming to all the areas across the Trust. We've already got significant elements of falls prevention that we should be completing with patients. We have the risk assessment tool. It's really important that this is completed with every patient following a risk assessment to see if they're at risk of a fall. All elements of this risk assessment must be completed and the action should be carried out to make sure that we're doing everything to reduce that patient's risk of falls as an inpatient across Trust. We also have the red slipper socks, which are a new change that came in around 12 months ago. These work really well for patients that have got inappropriate footwear on, because we can give them an alternative to make them safe on the wards. Also, for those patients that may get out of bed who lack capacity, these slipper socks can also reduce their risk of harm should they get out of bed. This is the tips to prevent you falling in hospital card. This should be kept at the end of every patient's bed. When a patient's admitted, this should be given to the patient or their relatives and used as a conversation prompt to help complete your falls prevention care plan. There's elements on here that prompt a conversation around certain things, such as have they been going dizzy, are they on certain medications that could put them at risk, are the shoes and slippers appropriate? And it's then that we can introduce early actions and make sure there's a safe plan of care in place. This is an A3 poster that's displayed in every clinical area. This is 8 simple steps to preventing falls, and this reminds staff what they need to be doing with the patient to reduce their risk of falls. If this isn't displayed in your clinical area, please let me know and I'll make sure that this is distributed to you so that it can be displayed for all staff to see. Bay tagging is one of the tested changes that we've used, which can only work successfully in certain clinical areas where the layout allows this to be carried out. The bay tagging process is about having a nurse or a healthcare assistant present at all times in the bay area. The benefits of this is that buzzers can be answered promptly, patients who are getting up unsupervised can be attended to, relatives and patients feel safe with the constant presence of a health professional at all times, and patients can be observed most of the time. The tag should be handed over to the other nurse or healthcare assistant if you're leaving that clinical area, so the bay should never be left unattended. This is the falls action card. Every patient receives this in their notes at the end of the bed. Urine results, lying and standing results and medications that could put them at risk should be identified and reviewed by the nurse and doctor. This is evidence that we've completed this to reduce the patient's risk of a fall. If a patient falls again on the ward, these results should be revisited and reviewed by the doctor. In the past, lying and standing blood pressures have missed being reviewed, or medications haven't been reviewed as they should have been. This is a way of bringing that MDT approach to the actions to ensure that we're doing everything to reduce that risk of falls. This is the Call Don't Fall locker poster. This is placed at the side of every patient's bed on the side of the locker. It's a simple communication aid to remind patients to press their buzzer for assistance when mobilising. Patients have reported that after looking at this, it has prompted them to press the buzzer for assistance. So it is worth having it displayed next to every patient's bed. Many patients fall getting up from the toilet unattended. This poster should be placed at eye level opposite the toilet to remind that patient to press the buzzer for assistance before getting up. Every patient deemed at risk of fall should be given the Preventing Falls in Hospital leaflet, or their relatives if they do not have capacity to read this information. This leaflet explains what they can do to help prevent their falls in hospital and what us as staff members can do to reduce their risk of falls, and together we can have a partnership in reducing their falls and making them safe in hospital. The Falling Leave system is to raise awareness for all members of the multidisciplinary team who is at risk of falls or has had an inpatient fall. After risk assessment has been completed and the patient is deemed at risk of a fall, the amber leaf should be placed over the patient's bed. If the patient is admitted with a fall, they should be given a red leaf because they're at higher risk of an inpatient fall. And if the patient does have an inpatient fall, then the red leaf should be applied because that patient is at more risk of further falls. Let's continue to make patients safe in our care at ELHT. Together, let's eliminate avoidable falls.